So how many people in this room are architects? Ooh, that's good. So the reason I asked that question is because I went to university to try and study architecture, but was rejected. So I ended up studying medicine. So that's why but it's really great to be in front of people who I might otherwise have been. Anyway, so what I'm going to do briefly, and I will try and be brief actually, because I think we've got discussion at 10. It'd be really interesting to hear some of your thoughts. So what I'm going to talk about is take what Ian has said about the hospital and just take it a bit more widely, both in terms of the health system, but also far future in time. And one of the people who I strongly recommend you don't leave this conference and miss is Blair Sadler, who's already been mentioned. So is that Blair? Can I say Blair? Yeah. So Blair, so don't miss Blair's session later, because he's been a very inspiring person in pulling together all these bits. So this first slide really is actually taken from the Future Hospital Commission. And whenever you talk about quality of healthcare, and Ian is absolutely right to keep going on about what does it mean to patients to have a high quality experience in a hospital, but also in a health system and a social care system and more widely in society. And one of the things that's very interesting is that when you look at what quality is, you can always dissect it into various components, and different people dissect it into different components. But what the FHC have done very well is divide it into these sorts of things. You know, what does it mean for the patient? Are we getting the best use of resources? And I think when you're looking at specifications, when you're sitting with partners to design systems, whether it's designing a hospital or a pathway of care or a model of care, you need to have all these things in and what's really impressive is that the Royal College of Physicians is the first organisation that's really started to embed sustainability as a dimension of quality. So, you know, this is really, really important. We cannot do today what we're trying to do today with no disregard for the future. I am very interested in the future. That is where I'm going to spend the rest of my life. I don't know about you, but, you know, we cannot afford to deliver things which seem fantastic today, but knowingly harming and prejudicing the chances of other people who have no voice, no choice. Okay? So, full marks to the RCP for doing that. So, healthcare services should meet the needs of the present without compromising the needs of the future. In time, elsewhere, and I'll give you a few examples of those. So it is well known, I hope you realise it's well known that we're fast running out of resources and we're fast soiling the nest in which we live. And those of you who are going to be around tomorrow may know that The Lancet, this last journal on the right, published this about 6 years ago. Climate change is the biggest strategic global health risk of the 21st century. So profound has that report been that they're updating it and they're republishing it tomorrow, launching it in 4 cities across the world tomorrow. So if you think the logistics of this conference are complex, tomorrow is going to be real fun, trying to get this thing launched in 4 cities simultaneously, including Beijing. So this is a big issue. So we know what the issue is. We know there's some real challenges with resource use, not just financially, but environmentally, and exactly as Ian was quite rightly intimating, socially, and the social assets of how we deliver healthcare in terms of not historically doing things to people, not even doing things for people, but actually doing things with people. Now, that might sound cute, but it's incredibly difficult. You know, when you're on a busy ward, and, you know, just taking those guys away in Worthing to do that video must have been quite logistically difficult. But actually, it's really, really tricky. It's all very well to say we like to do things in partnership. We like to build on the assets of fact. It is incredibly difficult, especially when you're trained in a way as a technical fixer, not as a system designer. So I'll just give you some data about the sort of challenge we have in front of us. I don't know how many people here have ever measured their environmental footprint. Well, actually, how many people haven't? How many people in this room have ever tried to measure their environmental footprint, their carbon footprint? Well done. Oh, that's pretty impressive. Okay. So how many people in this room know their salary? And it's not a cheap gag, I have to say, because actually if you're keen on providing the best for your loved ones and children, your salary is very, very important. But so is your environmental footprint. Very, very important. It's just that it's manifested in a slightly different way. Anyway, this is the health service in this country, the NHS, social care, public health. This is the largest global footprint ever done in the world. We've done it 3 times. We did it with the Swedish Stockholm Environmental Institute. And we're up there in 2015. Can you see where the end of that blue line is? Then we need to be down here by 2050. Okay? Now, we need to be there for 2 reasons. One is the science, and the second is the law. It is enshrined in law. Okay? Now, does that not look to you like a graph where it says, and a miracle happens here? Well, it is, isn't it? So one of the words that Ian was using, quite rightly, is not efficiency, not making things a bit better, but absolutely transformation, not just of the hospitals, not just of the healthcare system, but the society in which we live. We have the opportunity to transform the society in which we live and survive, or not transform the society in which we live and do something else, because we won't. That's the bad news, but actually I'm going to tell you some good news as well, on the basis that Martin Luther King did not say, I have a nightmare. Okay? So I will tell you some really good, and where you sit in helping design structures and systems within healthcare is a fantastic opportunity, because there is no sector in civil society that has a better opportunity to shape a sustainable future than the health and care sector. But it's not going to come just from clinicians. It's not going to come from policy wonks. It's not just going to come from politicians. It's going to come from people like you who are knowledgeable about designing systems of care and systems of prevention and care. So let's have a look at some of those things. So if you want to know what makes up such horrendously large ecological footprint of the health and care system, it's largely what we buy. It's stuff we buy. Okay? There's a bit of travel, there's a bit of energy in there, but it's what we buy. So for instance, the largest single thing that provides harmful, avoidable, environmental, ecological impact are pharmaceuticals. Okay? And paradoxically, they're one of the tools that we as clinicians have that are one of the most effective things as well. So there's a challenge, isn't it? One of our most effective tools, pharmaceuticals, which has revolutionized healthcare. You know, about a third of us in this room probably wouldn't be here if it weren't for the revolution in pharmaceuticals since 1940. It also has one of the biggest community societal side effects. And you can graphically display that in any way you like. And hospitals have their role to play. So that's about environmental impact. Now, I want to talk about not just environmental impact, but about social impact of healthcare systems. So does anybody know which hospital this is? Well done. It's QMC. This is Queen's Medical Centre in Nottingham, one of the largest hospitals in Europe. It's joined with the City Hospital now. And that is the assistant head of catering. Not the head of catering, not the head of estates, assistant head of catering, John Hughes. Okay, this guy is a hero. I'll tell you what he's done. He has revolutionized the food system. Now, one of what Ian was saying was about the patient experience. One of the things that's really important in a hospital system is how we feed people. Okay? Now, it sounds a bit of a gag, but one of the things that's quite interesting is if you ask patients what was their experience like in hospital, they won't quite say this, but they'll almost say, well, they cut the wrong leg off, but the food was fantastic. Or, they cut the wrong leg off, but at least I could park. So never, ever, ever underestimate the total package of what it means to have a good experience in a hospital that you would recommend to a member of your family or a friend. Okay? So what John has done is he's sourced a known percentage of all food from Nottinghamshire. He's worked with the farmers, he's worked with dairy farmers, vegetable farmers, meat. He provides a seasonal diet. The food is so good in these hospitals that citizens who pass the hospital say, let's go into the hospital canteen for food as a social. It's true, it's true. Not only has he done that, but in doing so, he has got people with learning difficulties on to a job trajectory, giving qualifications to people learning difficulties to help prepare food to get them a meaningful job. So the NHS as an employer. So the NHS in this country contributes about 10% to GDP. Okay? Employs about 10% of people. Employs about 1.4 million people. Okay? So if you cannot, with your buying power, if you cannot, with your employment power, be an organisation which is fit for the future, when you control 10% of the GDP, you need to go home and get someone else to come and do it. Okay? And it's partnerships with people like you that will make that happen. So thirdly, it's all about the ethical sustainability. I don't know if you knew, but most surgical instruments that we use as clinicians in this country start their life in northern Pakistan. Most of them start in northern Pakistan. If you saw the working conditions of the young children who start making surgical instruments, they're normally finished in a place like Germany or the USA or Japan, but they start their life in northern Pakistan. It is horrendous. Could we do something about that with the supply chains? Absolutely, if we choose to do so. If we choose to ignore it, that's another thing. But we would have enormous influence, and that is already starting with another Royal College, RCGP, British Medical Association, and the Medical Fair and Ethical Trade Group. So we have enormous influence, not just on the design of a hospital, but where a hospital fits in to an even larger system. So one of the convenient truths about this is not that we have to drop what we're doing today and concentrate on the future, about which many people care very little. And believe me, most people in the healthcare service, for understandable reasons, are crisis junkies. We absolutely are. I mean, we're trained. My idea when I was a clinician and planning was to reach the end of the clinic. That was my idea of planning. Okay, so don't think that people in the healthcare system have got visions into 10, 25 years. That's absolutely not true. But the wonderfully convenient truth is that nearly every intervention you do about making the health system future-proof will give immediate benefits. Partly for the public, and this is around prevention, and partly around the health system, that actually, if you have a better healthcare system, we would actually have the sort of hospital you saw Ian show in Northumbria, which could be highly specialised, highly focused on a particular need, not let's try and do all district general hospitals scattered around, hoping that the right people turn up with the right needs and we've got the right teams, because that's not going to happen. So the idea, and that's why, you know, it's really, really important to remember what Ian and Chris was saying about better models of care, not better piles of bricks and mortar. So that video showed you a system, not what a wonderful room, what a wonderful bed, what a wonderful piece of kit. It's a system which involves people. So that's just another way of saying it, that in many ways, we don't really need to worry too much and get over-obsessed about climate change. Look at all those wonderful things on the right that the healthcare system could contribute to a really wonderful legacy which you and I would be proud to leave, and that would be great for the healthcare system. So what I want to do now is just finish off with a few examples in the last 2 minutes around some examples of what hospitals not could look like, but are already looking like in a fair, sustainable future. Sustainable environmentally, sustainable financially, sustainable socially, sustainable ethically. The sort of health system that you would be proud to say, I helped create. Okay. So as Chris was saying, I worked for a couple of years in rural China. And one of the really interesting things about working in a different culture is you learn a lot about your own culture. And one of the wonderful things I saw there was the way we paid. Economic incentives are quite important. Do you all know that? How you pay people? They get. So it's really, really important how you pay people, how you pay organizations. In China, one of the ways in which village doctors used to be paid was the way every member of the commune, I worked in a very communist part of the country, the commune, every family in the commune would pay the village health worker a small amount of money every month while their family were well. If any member of your family becomes ill, you may stop paying. Now, what that is what's called an aligned financial system. You're aligning the money with what you want to achieve. Not activity, but prevention and outcomes, not activity. Don't ever pay for activity, because if you pay for activity, you'll get more activity, whether you need it or not. Okay, this is another hospital at the other side of the globe. This is a hospital in an HMO in the United States called Kaiser Permanente, which many of you will know. And one of the mottos of that organization is unplanned hospital admissions are a sign of system failure. Okay, so it's very, very important to understand that hospitals are absolutely crucial as part of a network in a system. But actually, just like that hospital in Northumbria, you only want people in hospitals when they need to be there. For their sake, for the sake of your purse, and for the sake of the environment. Because as soon as you have an integrated, vertically aligned, vertically integrated system, and you start admitting people into your system when they don't need to be there, you will go bust, and you will not have a compassionate system of care. Okay? This is a hospital in Nepal. Now, one of the problems of working in Nepal is that you very often get power cuts. It's actually quite difficult to run a small hospital with power cuts. But actually, this runs completely all the time on solar energy. It's completely powered by solar energy. The interesting thing is not the tech. Solar energy is a relatively easy tech to install. What is really interesting, what is really innovative, is the way in which it's funded. Okay? It's funded by a funding model that helps them pay over 8 years. Now, if you live in the health service, if finance directors in the health service want to see a return on investment on net present value of something like 2 to 3 years, you cannot do investment, you cannot do innovation if you have returns on investment that are that small. So that is about good funding models. And that is hugely important to the sustainability, financially and otherwise, of the system. So, to summarize in the last 30 seconds, sustainability in terms of you and I doing things which we'll be proud about, which we'll see in 10, 15, 25 years, has 3 elements. Financially, we have absolutely no right to squander resources which are not ours. Environmental, we do not want to steal from the future. We do not want to steal the life chances of people elsewhere or in the future by soiling our nest now, knowingly. We do this knowingly. This is not a tomorrow issue, this is a today issue. And thirdly, socially and ethically. So hospitals are one really important part of a system which has 5 important opportunities, and this is why I would buy a share in your company if you convinced me that you had embedded this really genuinely in your organization or your team or your vision. One is flexibility matters massively. You know what the time span of designing a state is. By the time you start the decision and by the time you delivered it, the world is a massively different place. And it may not have escaped your attention that the world is changing now much more quickly than it ever has. Flexibility. Prevention. You know, how you monetize prevention is incredibly important. That's really, really tricky. Can you think of business models where you financially reward people for absence, not presence? Okay, not doing the cheapest hip replacement. It's how can we reward a system for stopping people coming into hospital because their social system collapses at home. Those data that Ian presented about frailty and dementia and age, you know, we want to help people live better, not die longer. Okay. So thirdly, through new models of care, with a default place of care being home. Primary care is home, secondary care is with your general practice, specialist care is within a hospital, a networked hospital system. Empowered staff and patients. You know, IT, the internet has only just begun. You know, you might think it's revolutionary, but it's only just begun. You know, people in years to come will come back and look at a video of us having conversations today and think, they knew nothing about how IT can change the world. You know, IT has done more to bring women out of poverty in Africa than almost any other intervention. Okay? IT. Mobilizing people with cheap mobile technology, access to markets, empowering people. And we have seen nothing of it in the healthcare system yet. And lastly, health systems and professionals being visible exemplars of a safe and sustainable future. One of the things we're trying to do in this country is to have the NHS completely kickstart the renewable energy business in this country, to give the markets confidence. So you can see offshore turbines with NHS written on them, because the NHS believes in a clean, sustainable, fair future for everybody. And that's how we would make use of a social movement with 1.4 million people spending £105 billion of our money every year. So if you want to learn more about it, then there are courses you can come on. There's a particularly interesting course in September, which I'm happy to give you details, which is for about 35 global leaders in this business. And it's really great that so many of you have joined us from overseas. And those are my details. Thank you, Chris.